Low vitamin B12. According to the nutritional symptoms you noted in your answers to the nutritional quiz, you may have symptoms of a vitamin B12 deficiency. To refresh your memory, here's the background information on vitamin B12, and following that are our recommendations to help you increase your vitamin B12 levels. Vitamin B12 is necessary for the proper growth and development of your body's red blood cells. Pernicious anemia, a disease that was fatal before 1920, can result when your body does not absorb enough vitamin B12. It was discovered that pernicious anemia could be cured by eating large amounts of liver, and later it was found that liver contains both vitamin B12 and a substance called an intrinsic factor, which your body requires to effectively absorb vitamin B12. It's thought that B12 may also play a role in controlling blood levels of homocysteine, the amino acid which is believed to cause damage to blood vessels. Taking supplements of vitamins B12, B6, and folic acid has been shown to return the level of homocysteine to normal, and thus it's believed that these B vitamins may provide valuable protection against heart disease. Additionally, vitamin B12 is necessary for the function of all nerve fibers and for the production of genetic material within cells and the metabolism of fats, carbohydrates, and proteins. Vitamin B12 deficiency is more common in the elderly than in younger people. And here are our vitamin B12 recommendations. Foods are your best sources of all nutrients. If your turbo chart shows deficiencies of any B vitamins, increase your intake of vitamin B-rich foods. Take a good multivitamin mineral capsule or a B complex tablet daily with a meal, and follow all and any recommendations that will improve your digestion. Vitamin B12 is the only vitamin that's found in very few vegetarian sources. It is most plentiful in meat, fish, milk products, and eggs. Sea vegetables like arami, bladderwrack, dulse, hijiki, kelp, kombu, nori, sea palm, and wakame. It's in those. It's in mushrooms and tempeh, which is a fermented soy product. They all contain some vitamin B12. Although reports vary about their reliability as sources, they are very nutritious foods, and it would be a good idea to add them to your diet. We need only very tiny amounts of vitamin B12, but it is crucial. Vitamin B12 is the only vitamin that is stored in your liver, and most people have enough stored in their livers to last at least 5 years. The only people who may not get enough vitamin B12 in their diets are long-time vegans who haven't eaten any dairy food or eggs for some years. So they may need supplements, especially pregnant or nursing women. But note that many vegans do have adequate B12 blood levels and never need supplements. Vitamin B12 works with vitamin B6 and folic acid. Low levels of B6 inhibit B12 absorption, and smoking also inhibits absorption of B12. Most people who have a vitamin B12 deficiency have plenty in their diets but are unable to absorb it due to lack of intrinsic factor, which is the substance necessary for the absorption of B12. Sufficient stomach acid is also necessary for B12 absorption. Therefore, many older adults are at risk of vitamin B12 deficiency. Many of the symptoms of vitamin B12 deficiency, which are fatigue, headaches, irritability, and lightheadedness, resemble those of other nutritional imbalances. So a blood test will determine if you have a B12 deficiency. And if your doctor does prescribe a supplement, look for a sublingual, which means it goes under your tongue, a sublingual pill, or a nasal supplement, as they are easier to absorb. And B12 supplements should be taken about 1 hour before meals for best absorption. And that's the end of our vitamin B12 recommendations.